Have you ever wondered why some seniors seem to decline so rapidly while others maintain their vitality well into their 80s and 90s? It's a question that haunted me after watching my own grandfather go from vibrant and independent to bedridden in just over a year. His doctors kept focusing on his heart disease, but something else was clearly accelerating his decline. The truth is, while we're busy watching for the obvious health threats like heart disease and cancer, there are 6 deadly causes that silently claim lives after age 71 that rarely make headlines. These aren't just medical conditions. They're stealthy life enders that affect millions of seniors every year, yet most families have no idea how to spot them until it's too late. Today, I'm going to walk you through these 6 deadly causes and the subtle warning signs that could save your life or the life of someone you love. We'll discuss not just what to watch for, but exactly what to do when you spot these signs. Stay with me until the end because the final cause we'll discuss is perhaps the most overlooked yet easily preventable of all, and knowing about it could add years of quality life for yourself or a loved one. The first deadly cause of death that goes largely unrecognized in seniors over 71 is silent dehydration. Unlike younger adults who feel thirsty when they need water, the aging body's thirst signals become significantly dulled. What makes this particularly dangerous is how it masquerades as other conditions. Mrs. Patterson, a retired teacher I worked with, was repeatedly hospitalized for what doctors initially diagnosed as confusion due to early dementia. It wasn't until her 3rd admission that a particularly thorough nurse recognized the true culprit: severe dehydration. By then, her kidneys had already sustained damage. Here's what happens physiologically. As we age, our bodies contain approximately 10% less fluid than in our younger years, while our kidneys lose some ability to concentrate urine and retain water. Simultaneously, certain medications common in seniors, especially diuretics for heart conditions and blood pressure, accelerate fluid loss. The perfect storm develops when these factors combine with a diminished thirst response. Watch for these often missed signs: increased confusion or sudden mood changes, dizziness when standing that's dismissed as just aging, persistent fatigue that doesn't improve with rest, less frequent urination with darker urine, sticky feeling mouth and tacky tongue. What makes dehydration deadly is how it thickens the blood, creating the perfect conditions for clots, strokes, and heart attacks. It also amplifies the toxicity of medications, as concentrated drugs circulate in less fluid. If you notice these signs, don't just push water immediately. Start with small, frequent sips, adding electrolytes for better absorption. Schedule a medication review with a doctor as adjustments might be needed. Most importantly, implement a hydration schedule rather than relying on thirst cues, typically 6-8 cups daily, starting early in the day to avoid nighttime bathroom trips. Some seniors resist drinking because they fear incontinence or frequent bathroom trips. Address these concerns directly by spacing fluid intake during waking hours and exploring continence solutions with healthcare providers if needed. Now let's move to our second deadly cause, which often works hand in hand with dehydration to create a life-threatening situation. The second deadly cause claiming seniors' lives is something doctors rarely discuss with patients: medication cascades. This occurs when a side effect from one medication is misinterpreted as a new medical condition, leading to prescription of additional medications, creating a dangerous downward spiral. Consider what happened to Robert, an active 75-year-old who started on a blood pressure medication that caused mild ankle swelling. His doctor prescribed a diuretic for the swelling, which depleted his potassium and caused muscle weakness. This weakness was misdiagnosed as early Parkinson's, leading to another medication that caused confusion. Within 8 months, a previously independent man was taking 7 medications and needed assisted living. The science behind this is alarming. With each decade after 50, our livers become less efficient at processing medications, while our kidneys excrete them more slowly. This means drugs stay in an older person's system longer at higher concentrations. Additionally, with age comes changes in body fat percentage and reduced albumin, a protein that binds to drugs, dramatically altering how medications are distributed and activated in the body. What makes medication cascades particularly deadly is that they're often unrecognized until multiple organ systems are affected. The risk increases exponentially with each medication added. A person taking 5 or more medications has an 88% higher risk of adverse drug events than someone taking fewer. Watch for these warning signs: new symptoms appearing within weeks of starting a medication, gradual decline in function without clear cause, unexplained falls, especially if they began after medication changes, increased confusion, lethargy, or personality changes. Symptoms that improve during brief hospitalizations, when regular medications might be temporarily paused. If you notice these patterns, request a comprehensive medication review with a pharmacist or geriatric specialist, not just the prescribing doctor. Bring every medication, including over-the-counter drugs and supplements, to this review. Ask specifically, could any of these symptoms be medication side effects rather than new conditions? And, are there medications that could be reduced or eliminated? Never stop medications abruptly, but work with healthcare providers on potential deprescribing, the planned reduction of unnecessary medications. Sometimes simply adjusting timing or dosages can break a dangerous cascade. If you're still with me, you're clearly someone who cares deeply about protecting yourself or your loved ones from these hidden threats. I'd love to know in the comments which of these first two causes surprised you the most: the silent dehydration or the medication cascades. Don't forget to subscribe for more life-saving health information like this. Up next, we'll discuss a deadly cause that's completely missed in about 80% of cases, yet entirely preventable when you know what to look for. Our third deadly cause that silently claims seniors' lives is undiagnosed urinary tract infections. While a UTI might seem like a minor inconvenience to younger adults, in people over 71, it can rapidly become life-threatening, and the classic symptoms you'd expect are often completely absent. I'll never forget Emma, an 82-year-old whose family was told she had rapidly progressing dementia when she became confused and agitated over a single weekend. As they prepared to move her to memory care, a visiting nurse suggested testing for a UTI. The test was positive, and with antibiotics, Emma's dementia disappeared completely within days. Here's what happens. As the immune system ages, it mounts a less robust local response to infection. This means the classic burning sensation and urgency that would send a younger person to the doctor may never appear in someone over 71. Instead, the infection silently spreads, potentially reaching the kidneys or entering the bloodstream as sepsis before anyone recognizes the problem. The most common presentations of UTIs in seniors are actually neurological: sudden confusion, increased falls, lethargy, or behavioral changes. These symptoms are frequently misattributed to dementia, stroke, or just getting older, leading to dangerous delays in treatment. Be vigilant for these often missed signs: sudden onset confusion or worsening of existing confusion, falls or new unsteadiness when walking, unexplained fatigue or lethargy, low-grade fever, often below what's considered significant, changes in urination that might be subtle, slightly darker urine, more frequency, or mild incontinence in someone previously continent. What makes undiagnosed UTIs so deadly is the rapid progression to urosepsis, a systemic infection that can cause blood pressure collapse and organ failure. The mortality rate for seniors hospitalized with urosepsis exceeds 30%, yet the initial infection is entirely treatable when caught early. If you notice these symptoms, request a urinalysis immediately, even if the doctor seems skeptical. Insist that confusion or behavioral changes in seniors should never be assumed to be just aging without ruling out infection. Keep in mind that standard dipstick tests sometimes miss UTIs in seniors, so a urine culture may be necessary. Prevention is equally important. Ensure adequate hydration, connecting back to our first point. Maintain good hygiene, and completely empty the bladder when urinating. For women, wiping front to back remains important at any age. Cranberry supplements may provide some protection, though the evidence is mixed. Now let's move to our fourth deadly cause, which often compounds the dangers of the previous three. The fourth deadly cause claiming seniors' lives isn't a disease at all, yet it kills as effectively as smoking 15 cigarettes a day. I'm talking about social isolation and loneliness, conditions that affect nearly 43% of adults over 71, but are rarely addressed in medical settings. When Henry's wife of 52 years passed away, his health seemed stable. But within 18 months of living alone, this previously robust man experienced rapid weight loss, developed uncontrolled hypertension, and suffered a major stroke. His doctors focused on the stroke's physical causes, never addressing the profound isolation that had triggered a cascade of physiological changes. The science behind this is compelling. Chronic loneliness triggers the stress hormone cortisol, creating a state of ongoing inflammation throughout the body. This sustained inflammatory response damages blood vessels, reduces immune function, and alters gene expression in ways that accelerate aging. Brain scans of chronically lonely seniors show patterns remarkably similar to those experiencing physical pain. What makes isolation particularly deadly is how it amplifies every other health risk. Isolated seniors are 50% more likely to die prematurely than their socially connected peers, 29% more likely to develop heart disease, 32% more likely to have a stroke, 64% more likely to develop dementia. Watch for these warning signs: declining interest in previously enjoyed activities, decreased personal grooming or home maintenance, missed medical appointments or medication refills, resistance to leaving home even for necessary errands, significant life transitions, loss of spouse, moving from long-time home, giving up driving. If you notice these patterns, approach the situation with sensitivity rather than simply pushing for more social activities, which can sometimes increase feelings of isolation if they don't create meaningful connections. Instead, focus on quality interactions. Even brief, meaningful exchanges can reduce loneliness. Technology can help bridge gaps, but needs to be introduced thoughtfully. Video calls with family, online communities based on lifelong interests, or even companion robots have shown promise in reducing loneliness. However, the most effective interventions involve having a purpose, volunteering, mentoring, or participating in intergenerational programs where seniors feel valued for their knowledge and experience. For families, scheduling regular, predictable contact is more beneficial than occasional longer visits. A daily 5-minute phone call provides more psychological benefit than a monthly day-long visit, as it creates ongoing connection and something to look forward to. If you're still watching, you clearly understand how critical this information is. I'm curious, have you noticed any of these first 4 deadly causes affecting someone in your life? Share your experience in the comments below. Remember to subscribe and hit the notification bell to access more life-saving health information. We're about to discuss our 5th point, which is particularly insidious because it's often mistaken for a normal part of aging. Yet it's one of the most preventable causes of premature death. Our 5th deadly cause silently claiming seniors' lives is unrecognized malnutrition. This isn't about hunger or food availability. It's about the body not receiving essential nutrients despite seemingly adequate food intake. Janet, a financially comfortable 78-year-old, maintained her weight and appeared well to her family. Yet when hospitalized for pneumonia, tests revealed severe protein deficiency and multiple vitamin deficiencies that had weakened her immune system and muscle function. Despite eating well enough, she had been slowly starving at the cellular level. Here's what happens. After 70, our bodies undergo several changes that affect nutrition. Taste buds diminish, particularly for sweet and salty flavors. Digestive enzymes decrease, stomach acid reduces, affecting vitamin B12 absorption, and even gut bacteria change. These physiological shifts occur precisely when caloric needs decrease, but nutrient needs remain high or even increase. Medication effects compound these changes. Many common drugs alter taste, reduce appetite, or interfere with nutrient absorption. Beta blockers for heart conditions, certain antibiotics, and many antidepressants all impact nutritional status. What makes malnutrition particularly deadly is how it creates vulnerability to everything else. Inadequate protein leads to accelerated muscle loss, sarcopenia, weakened immune response, poor wound healing, increased fall risk, reduced ability to recover from illness. The warning signs are easily missed. Unintended weight loss, even 10 pounds is significant. Increased susceptibility to infections, wounds that heal slowly, declining strength and increasing fatigue. Dental problems that make chewing difficult, eating alone most of the time, connecting to our isolation point. If you notice these signs, request nutritional screening beyond just weight measurement. Specific blood tests can identify protein deficiency and micronutrient gaps. Additionally, a medication review may reveal drugs contributing to appetite loss or nutrient malabsorption. Addressing malnutrition usually doesn't require dramatic dietary overhauls. Often, simple protein enrichment of existing food preferences works best. Adding protein powder to morning cereal, incorporating egg whites into favorite dishes, or using whole milk instead of skim can significantly improve protein status without changing eating patterns. For those with diminished appetite, nutrient density becomes crucial. Every bite must deliver maximum nutrition. High-quality meal replacement supplements can be helpful, but food-first approaches are generally more effective and enjoyable. Most importantly, make mealtimes social whenever possible. Studies consistently show seniors eat more and make better food choices when dining with others rather than alone. Now let's move to our sixth and final deadly cause, one that connects to all the previous points yet receives perhaps the least attention from healthcare providers. The sixth deadly cause that claims seniors' lives is progressive mobility loss, what geriatricians sometimes call the cascade to dependency. This isn't about needing a cane or walking more slowly. It's about a dangerous downward spiral that begins with small mobility changes and ends with complete immobility and its life-threatening complications. Consider George, who began limiting his walking after a minor fall that didn't cause injury, but did frighten him. Within 6 months of self-restricting his movement, he lost 30% of his remaining muscle mass, developed blood pressure issues from reduced cardiovascular conditioning, and eventually suffered a serious fall with hip fracture, from which he never recovered. The science is clear. Our bodies operate on a use it or lose it principle that accelerates after 70. Just 2 weeks of reduced walking can decrease muscle mass by 5 to 10% in seniors. This muscle loss further impairs balance, creating fear of falling, which leads to even more restricted movement. The deadly cascade begins. What makes mobility loss particularly lethal is how it leads to thrombosis, dangerous blood clots, pneumonia risk from decreased lung expansion, pressure injuries from sitting or lying in one position, and dramatically increased fall risk when movement does become necessary. Watch for these early warning signs: avoiding stairs or taking elevators when previously using stairs, using furniture for support when walking around the home, declining invitations to activities requiring walking, taking longer to get out of chairs or cars, narrowing of life space, the geographic area a person regularly navigates. If you notice these patterns, intervention must address both physical and psychological factors. Physically, focused strength training, even begun in the 80s or 90s, can reverse muscle loss and improve balance. Studies show that seniors can increase muscle strength by 25 to 100% within 3 months of beginning appropriate resistance exercise. Psychologically, addressing fear of falling is equally important. Evidence-based programs like A Matter of Balance help seniors acknowledge fears while developing realistic confidence. Using appropriate mobility aids properly, many seniors use canes incorrectly, actually increasing fall risk, can extend independence safely. For those already experiencing significant mobility decline, physical and occupational therapy evaluations are essential, not just for treatment, but for home modification recommendations that can prevent the cascade from accelerating. Remember, the goal isn't necessarily independent walking without assistance, but safe mobility that maintains as much muscle function as possible. Even bedbound seniors benefit from regular position changes and simple resistance exercises. We've explored 6 deadly causes that claim too many lives after 71: silent dehydration, medication cascades, undiagnosed UTIs, social isolation, unrecognized malnutrition, and progressive mobility loss. While each is dangerous alone, they often work together, creating perfect storms that can rapidly end lives. The good news? Every single one of these causes is modifiable when recognized early. Simple awareness and intervention can add years of quality life. Let's recap our critical action steps. Implement scheduled hydration rather than relying on thirst request medication reviews, focusing specifically on potential cascades. Consider infection first, not age, when sudden confusion occurs. Prioritize meaningful social connection as a health essential, not a luxury. Focus on nutrient density and protein adequacy, not just calories. Maintain safe mobility through appropriate exercise and environmental modifications. Remember that addressing any one of these areas often creates positive ripple effects across the others. Better hydration improves medication tolerance. Improved nutrition enhances mobility. Increased social connection often improves both nutrition and medication adherence. I created this video because too many families tell me, if only we had known sooner. Now you do know, and this knowledge is power. If this information resonated with you, please like this video and subscribe for more life-saving health content. Share it with someone who might benefit. It could literally save a life. What was your biggest takeaway? Let me know in the comments below. Until next time, remember that awareness is the first step to prevention, and it's never too late to make changes that matter.